Hi everyone, welcome again to the Emergency Department at the Leicester Royal Infirmary. Over the next few minutes we're going to go through some of the ED general top tips and golden rules that we all like to adhere to in order to make our lives and the lives of our patients as best as we can. First of all, looking after yourself. I think it's important to look after yourself so that you're in a position to look after your patients. Shift work by nature is non-circadian. Effectively, this means that it is not timed to your body clock, and the ED work in itself is quite intensive. I'm sure some of you would have heard what HALT means. HALT basically stands for hungry, angry, late, or tired. The other bit that we often add on is HALTS, where the S stands for stressed. It's quite easy to get stressed in the ED as well. However, there are top tips for this, and there are ways of actually dealing with this. Top tip number 1, plan your downtime. You're not your job, you are your life, which includes your job and your downtime. So it's important that you plan your downtime. You also need to make sure that you've got a hobby or your thing that you do outside of work. This doesn't have to do with medicine. This could be anything outside of medicine that you're passionate about, that you look forward to when you finish your job and move on to your downtime. It is quite easy in this job to actually drift from day to day, do your job, clock in, clock out, go home, sleep, and not quite feel you've had a life. Planning your downtime also gives you the time to reflect on what you need from the job, what you can get from the job, and what you can contribute to your job in the ED. It is as rewarding as you can make it out to be. We all need to look after mental health and general well-being in order to serve our patients better. The physical and mental health aspects are both important with regard to our ED jobs. And remember, there's always someone around in the ED to talk to. If you're feeling unhappy, talk to someone. If you're feeling tired, take a break, but make sure you tell your boss or your senior on the floor that you are taking a break because you're feeling tired. If you're hungry, please make sure you eat something. We don't want you to be hypoglycemic along with the patient. Not a good start. If you're feeling unwell, the first question is, are you safe to work? If you're not, or you feel you're not, and you're at home, call the JDA teams in hours, which is between 0900 to 1700 hours in the evening, or the doctor in charge via switchboard out of hours. Try and give us plenty of warning. It's difficult for us to cover a shift we've only got 1 hour or 2 hours notice for. We require as much notice as possible. This is just to make sure that we don't leave any critical gaps in our staffing and our patients continue to be looked after. If you're in work and you start feeling unwell, please ask for the doctor in charge, speak to them and see what you need to do next. If you need help because you're struggling with a health condition, be it physical or mental, please let us know. We are here to help you. Now, the next top tip about looking after yourself has to do with worrying. We all worry as clinicians. We worry about the patients that we send home probably more than the patients that we admit. And we also worry about some situations where, because of previous experiences, these situations stick with us and probably in a more negative rather than positive way. Top tip to deal with that. It's good to talk. ED seniors have been here before. All of us have been junior doctors before. No matter how distant the past it may seem, we may still have something to help you through your current situation. You will also be assigned a clinical and or an educational supervisor when you come to the ED. This person is responsible for your teaching, your training, and is also a mentor and provides pastoral support to you. Please let me know as head of service if you have any issues getting an educational or clinical supervisor assigned to you in the department. Of course, you can always talk to friends or family. However, there are some caveats in terms of patient confidentiality, and actually you may distress your family by discussing some particularly unpleasant things that may be happening at work from the patient case point of view. Looking after the team, we're all one team, we're all working under pressure. The important thing is that we have to look after each other in order to do the best that we can for our department and for our patients. The top tip would be, ask the names of your team. Who are the nurses you're working with today? Who's your registrar on? Who's your consultant on? If you feel someone's done a great job, say thank you. Fill in a great X. Fill in an above and beyond award if that some person's done something that's way above and beyond what you would expect them to have done within their job role. The important thing is, in order to make your colleagues feel valued, you must be punctual for your shift and take your allocated breaks so that you are not encroaching on their time because they're having to work longer because you were late. Managing your emotions. The ED exposes you to pressure. It is very easy to get angry, to get frustrated, and to actually react to situations that may happen around you in a way that's less than ideal. A top tip would be, don't judge colleagues or patients. It's very easy to judge someone from a second or even a third party point of view when you don't know what they've gone through. Remember, Peter Rosen said, nobody wakes up this morning and decides to ruin or completely mess up your day. They've just done something because they feel a particular way. What happens to you is one part of the situation. How you choose to react to it is the more important second part of the situation and feeds into what happens next. Happiness is your choice. Be happy and stay positive. Don't react to situations that you have control over in terms of reacting. Looking after your patients. The emergency department is unique in that it manages pretty much everyone from age 0, that is a newborn child, maybe just a few hours or minutes old, to someone who is well over the age of 100. And conditions that range across any specialty you can think of, including palliative care medicine and intensive care, can be quite a challenge. Here's a top tip. The emergency department and emergency medicine in general is a team sport. You don't have to manage sick patients on your own. You do have a much larger team to support you and to help you manage your sick patients. We are here to help you and to help each other. You won't know everything, but we do expect you to be 100% reliable. If you don't know something, just say so, and we will be there to help you. You will also encounter a lot of new situations which you may or may not be prepared for in terms of your medical training. A top tip would be to never be arrogant. Everyone here has something to learn from someone else and at the same time something to teach someone else. Ask for advice, not just from the seniors who are always around, but also from any member of staff that you may see, because you'd be surprised at the level of experience and knowledge that you can find in some unexpected quarters with your medical training background. The other thing to remember is that the emergency department work and emergency medicine in general is error prone and has risk attached to it. Don't be reluctant to ask questions. The other thing to remember is please do go back home and read at least one patient presentation every shift. There are lots of resources available, not just in terms of books, but also in terms of Twitter and Format for easy learning. The EM3 website that you can find if you go through Google is a very useful resource that signposts you to curriculum competencies and also general medical knowledge. Do you know when most of mistakes happen in terms of patient care? Well, actually, it's during handover. So then it's really important that we are thorough and clear during a handover. Please use Nerve Center for documenting the operational side of the patient journey and use the clinical notes for the clinical side of the patient journey. And please don't forget to code your patients. This is really, really important. Avoiding complaints. Complaints can come from various sources. One of them can be from GPs. This is mostly due around little tasks that can be done by us that are then passed over to the GP, who are themselves quite busy practitioners in the first place. So top tip would be, for example, writing sick notes that are increasingly called fit notes that we could have written rather than passing them off to the GP, as we know more about the patient's condition than a GP who's not seen the patient for the last couple of weeks. The other thing that could get the GP quite upset would be to be told that you need to organize X, Y, or Z in terms of investigations and putting in the GP letter that your GP will organize this. What I would suggest would be to say, could you please review the patient with a view of considering whether this could be done. The other thing that really does upset GPs is the lack of information on a discharge letter. Please do this yourself and do it in a contemporaneous manner rather than leaving it to the nurses. It's unfair. We do not expect nurses to do that. Patients can bring in complaints too about what's happened to them during the patient journey. Quite often this is not about the diagnosis, it's about how nice you are to them as a doctor and as a human being. I want you to think back about what the episode that has brought them to hospital is doing to their lives. You need to make sure that you are reassuring of the patient. You can tell them this is what we normally do in this situation. Let them know when they're definitely staying in hospital. And it's quite often that we do know that they are an obvious admission. It is useful just to let them know. In fact, if I was a patient, I would want to know where I was going next. Also, do let them know about the waiting time. Say, for example, it's going to take X number of hours to get you to a bed. We're waiting for a bed to come up. Also offer them updates. You could tell them that the surgeon will be about an hour or about half an hour to come down and review them and give them an expectation of what's going to happen next to them. Also, please do tell them if they've been transferred to another hospital for a specialist service such as the Glenfield for cardiology or respiratory medicine and the Leicester General for hepatobiliary surgery and renal medicine as well as urology. It's important that we enjoy working in the ED. After all, it's not just a job, it's a vocation, it's a profession and it's a way of life. I do not want any of us to forget that it is a great privilege and a responsibility that people who you don't know ask for your help, and this may be in the worst day of their life. We look after people unconditionally, and in some people's eyes that is what a family is there for. So we do perform a really important and privileged role. Thank you, everyone.